Welcome back to another interview with the National Spine Health Foundation. I'm your host, Erica Anderson, and today we're speaking with Dr. Shay Bess. He's an orthopedic spine surgery specialist and president of the International Spine Study Group Foundation. Thank you for joining us, Dr. Bess.
It's a pleasure. Thanks, Erica.
Yeah, so we've been talking this month about research. That has been our focus. We know that that is so important to the spine world, and we know that you have worked on some of that yourself in your ongoing work. And so I would love to just kick it off by asking you, what is some of the most exciting research you've been working on lately?
Sure. I'm so glad you guys are focused on this, something very near and dear to my heart. You know, what we're doing right now through the ISSGF, or the International Spine Study Group Foundation, we have really 5 studies that are ongoing right now, soon to be 6, actually soon to be 8, to be honest with you, but they're all falling into 2 general umbrellas. There is a thoracolumbar study and then a cervical study. And then some of them were initiated in roughly 2008, 2009. And those have closed for new patient enrollment. And then we just kicked off 2 new ones, though, under those same umbrellas. Again, thoracolumbar and then cervical deformities for adults. And those started roughly 2018. And those are in windows now for not only patient follow, but also for patient enrollment. So, and really, again, focusing on adults with spine deformity that have deformities either in their cervical spine or in their thoracolumbar spine. And then if you look at treatment for those, what we're evaluating is in the thoracolumbar especially, is looking at open treatment versus minimally invasive surgery for these patients. And then within each of those then study cohorts or studies, then we're looking at specific questions then.
And so when you're sort of in the planning stages of what you're going to research, how do you come down to ultimately making the decision about what you are going to focus on?
That's a great question. So initially, when we kicked our studies off in roughly 2008, 2009, we had a battery of ideas that we integrated into the database. And you know, the interesting about our data and our studies is that they're all prospective. Again, they're observational, but they're prospective studies. And so the data that we collect is really between level 1 and level 2 type evidence, which is very high quality data. And the reason is that we have these pre-thought or preset hypotheses that we then submit to the institutional review boards at each institution and are integrated into our fixed data fields for our database, and then work to answer those questions. And the studies that ran from roughly 2008, 2009 up until 2018 and that are in follow-up, those were based on questions that we had based on other studies from literature. But now these newer studies that we've just launched in 2018 are based upon, one, holes that we found in our previous database. So we want to add on to those data points. And then 2, looking then at our previous data, what did we really want to focus in on? So for example, one of the things that we had not completely layered into our initial analyses were the financial aspects of surgery. Cost per quality, who benefits the most, who's at the greatest risk for economic spend, who then and what products as well as biologics are at high versus low cost, as well as high granularity on the type of implants that are being used. But now, based upon our previous data, we've layered those into our new studies so that we can collect those in a prospective fashion, which is interesting because then it allows us to not only assess what the economics of treatment for adult spine deformity is, but what the cost per quality adjusted life year is, right? So namely, even though you have a large spend on these patients, is it really worth it based upon how much they improve in their quality of life? And we're finding that it actually does. Another example of this is we previously had touched on opioid use in these patients, but now we're collecting down to the exact morphine milligram equivalent of opioid use for every patient going forward, which is really, really exciting, especially what we know now, again, in the face of the opioid crisis, which wasn't as hot in 2009. And also these cost questions, which continually are important. The other piece for us also is it allows us then to partner more effectively and work with our other industry research partners on the effectiveness on their products, cost of their products, and then the cost for quality for their products as well. So it's been a very synergistic evolution, I think, for us within what we're doing. And it's great. You know, the initial studies captured about 2,000 data points per patient. These two new studies will capture about 4,500 data points per patient. So it's amazing, and the patients that participate and give their time for these studies really deserve the accolades for their patience and their participation. The other thing that we're doing is looking at performance for these patients, namely grip strength, ability to walk distance, and also looking at wearable technology to assess not only what they're doing, but how much they're doing it and where they're doing it. So it's very, very exciting.
Wow, that is a lot of like across the spectrum research that you guys are doing. I think one thing that is a struggle, and I'm sure you'll agree, is just that people don't realize the need for all the funding that it takes to do this research. Do you find that it's difficult to get the funding, and how do you sort of, I guess, talk with people or make that point that this matters and this is so important for the future of spine health?
It's a great point and a great question. The first piece I think that the majority of people don't really understand is the effort that it takes to actually do research, much less high quality research, right? And so you can have all these databases or registries that's kind of garbage in, garbage out, but in order to get high quality data and then to do a QA, a quality analysis of the data, takes a lot of people power and a lot of work hours, which then translates into a lot of money in terms of maintaining the infrastructure so people can get paid to actually do their work, maintaining a database, maintaining our ability to measure radiographs. And so it takes a special partner. You know, we've been very blessed by partnering, especially with industry who gets the real value for this. And where does that lie? I think that the value is, number one, is what we're doing really making a difference for these patients? So we have to answer that. Number two, there's a burden of proof that then comes with this, namely, if we're going to do these invasive procedures, if we're going to spend this kind of money, or if we're going to continue to innovate on these products, we need to then be able to demonstrate that they are actually making a difference for these patients. So one, that they get that. Number two is as products are entering into the market, especially in Europe, they need to then have a background of information or, again, burden of proof or quality metric associated with those products. And we can help with that process as well. And I think that being able to partner on multiple ends, again, working together on the burden of proof, showing that these interventions are working or demonstrating the ones that aren't working and figuring out why. And two, helping products that we find to be effective to get into the market. We've found to be a very, very good partnership in this area.
What is like a tangible example of, we did this research and as a result, we saw a patient experiencing a positive benefit from it?
Sure, that's a great question. So if you go back to kind of fundamentally, number one, looking at how a patient stands in the sagittal plane from the side, knowing again that if they're pitched forward, it causes pain. We knew that to some degree. But the components of it, namely how the patient compensates to maintain upright posture, how they rotate their hips, how they balance their spine through their pelvis, how they compensate through their neck and their thoracic spine to maintain upright posture. That has allowed us to then gain a better understanding of why patients are in pain. These real components of how we as human beings stand upright, and then what happens when we're unable to stand upright, what we do to compensate, and then how those compensatory measures then are painful. But then going further on that, gaining a greater cognizance that everybody has their own appropriate posture that may be the particular to them personally, or even a little more broadly to their age. And so the person who's 20 stands differently than the patient who is 80 years of age. And so surgically, we might not want to give the 80-year-old the posture of a 20-year-old, right? Because they probably can't tolerate it. And
Right.
so we're finding that out more. And so as we get deeper and deeper into these broad questions that seem somewhat simplistic, I know that we are impacting patients not only on an individual basis, because I apply it every day to my surgical practice, but then also to tens, if not hundreds of thousands of patients by getting the research out there, by the surgeons that are involved in our group, also taking those concepts to their patients and taking it to their partners and taking it to their fellows, but then also getting on stage and presenting it to an engaged audience and also presenting it then in the research journals.
How would you say, I mean, from my understanding, the world of spine health and the innovations and progress that have been made in the past 10, 15 years have been monumentally faster than they were prior decades. I don't know. I mean, you can correct me if I'm wrong on that. But is that true? And then how quickly do you see things progressing in the next 10 years? And what can we look ahead to that we don't currently have?
Sure, I think that the things that provide momentum for innovation is just what we started out talking about on this call is research and data, right? Otherwise, you're making decisions in a vacuum.
Mm-hmm.
But if you can build upon the data that you have and the research that you have, and if you've invested it wisely into your product innovation, it then becomes a very quick iterative process where, again, you are building upon a solid foundation. And as you collect data and you see the associated outcomes from what your output has been, you'll then be nimble and be able to then further create on top of what you have already created, if that makes sense.
Mm-hmm.
Then the question then comes is, are we going to continue to do it in the future? Gosh, I hope so. That's the business model for our foundation for the ICCF, right? That we're going to continue this process and make really spine care better for everybody, better for the patient, better for the surgeon, better for the hospital, and better for our industry partners, because we're all in this together in helping ultimately patients get better and understand then the pathologies and how we approach them. The things that I think that then are going to improve going forward are, number one, how we collect data, right? Because it becomes a very onerous, burdensome, time-consuming process, but you got to have it. And so how do we methodologically go about collecting those data? I think the answers to research questions, that's the fun part, but what can oftentimes get neglected is the methodology by which you come to those answers, right? And so how you administer then the questions and collect those data. I think innovation truly needs to occur within that. And if that occurs through either wearables or having a digital interface by which we can rapidly collect the data, we're currently using PROMIS, which is a patient-reported outcome measurement information system. Acronym, very a lot of words. We use the computer adaptive tests for that. And so it uses then logic to then administer questions so that there's not this huge questionnaire burden, so that we can get to an answer very quickly on the patient, on their pain, function, mental status, as well as social function. And so I think that is a tremendous innovation. But also, again, looking at function as well as what we're doing and how we're doing it through wearable technology, I think is going to be critically important.
Oh, that's so interesting. So what keeps you so devoted and passionate about this work?
It's fun. If it wasn't fun, I'd stop doing it. If I started having fun, I'd stop tomorrow. And I think that once it stops being fun, I'll stop as well. But I hope it never does. And the thing that makes it fun is working with wonderful people. You know, we're so lucky in the ISSG to have such smart, interactive, fun, engaging scientists and surgeons, and then being able to have that creative spark together. I mean, gosh, it's a blast writing papers and making presentations and giving it a talk to people. I mean, what's more fun than that? I mean, you know, some people can make music and some people can draw. I can't do either of those, but I enjoy writing, I enjoy creating, and I enjoy sharing with other people. And that's the fun of it. In the end, I guess from a 30,000-foot view, why are we doing it? We're doing it to help other people. And what's better than that?
Yeah, that's awesome. That's a great answer. Well, thank you, Dr. Bess. We appreciate your input. And, you know, it just goes to show why we're focusing on research this month. It is so important. It is sort of the key to moving forward. So thank you so much for your time.
Keep it up. Thanks for the time today. Bye.
All right. See you later.